Why do I choose ophthalmology? I would say it's kind of fate. When you're asking your doctor friends why you want to become a doctor, most of them will tell you an experience of losing an important friend or family member when they were young. So the feeling of protection drove us to become a doctor to protect and help. After medical school, I was attracted by ophthalmology, by its fashion and innovation of technology, by its delicate surgery in lens and retinas. So I became an ophthalmologist.
My journey has been from Singapore, so that's where I'm from, and then I came to London for medical school longer than I'm willing to admit, and stayed and worked here and built my life and family here. So I chose ophthalmology very late towards medical school. I originally wanted to be a vascular surgeon, but I was introduced to ophthalmology probably in my last year or two in med school, and I really enjoyed the intricacy and kind of microsurgery that came with ophthalmology.
Why do I practice in Guangzhou? I'm a Cantonese. Guangzhou is an ancient city and famous for delicious food. Guangzhou is elegant, with great inclusive, embracing people all over the world to chasing their goals and dreams. Second, medical school of Sun Yat-sen University and its affiliate eye center is world famous. I was very lucky to be trained here. Guangzhou Eye Hospital is one of the best eye center in Aier group. We have the best supervisor like Professor Tang and Professor Wu to help the young doctors to build up their career.
I would say working at Moorfields has been a privilege and a real joy. I have 300 colleagues that I know well over the last 2 decades. If I have a case to discuss, I can simply pick up a phone and speak to a friend. And we also have teaching and multiple meetings that allows me to keep up to date and really at the forefront of where eye care is at the moment. So I love working at Moorfields and I love living in London.
First, thinking carefully. Medication is not easy. As the old saying goes, look before you leap. Every clinical case may be similar, but they're also unique. Thinking carefully will help you to go further in this field. Second, deep reading. Patient in Chinese is 病人, disease and patient. He or she need to be cared as person first, and then we cure the disease. In English, they are patients who need to be treated with patience and sympathy. Deep reading will help us to improve our humanity knowledge and strengthen our attainment of humanities in the daily practice. Finally, always have your right motivation, because it will keep you to overcome the difficulties in your life and career, and it will keep you active to think, to read, to work, and to chase your goals.
I think telemedicine is so important for the future of ophthalmology. We talk a lot about artificial intelligence and digital innovation and where technology is going to bring ophthalmology to the future. I think that's really exciting, but in order for that to work, we need to build infrastructure where we are able to reach patients and even at home.
As a female doctor, it's a very important issue. Family is always in the first in my life. But in the modern society, women also can be outstanding and have their career. I have a daughter. I want to be a good model for her. So besides we play together, I also share my experience, my thinking of career with her. This platform provides the opportunity for Chinese eye doctor to communicate with the outstanding ophthalmologists all over the world. The communication will promote the progression of both sides to deliver the modern care for the patients. At this platform, I met Dr.Dawn Sim and Daniel T. We start out our cooperation in research and share our experience.
And this work really has led to meeting my colleagues in Aier, including JC Ma, who I think over the years we've become firm friends, and I've known her for a few years now. I've really enjoyed visiting several hospitals from Aier and meeting the doctors, nurses and staff there. I would say my kind of most fond moments is times when I've had shared teaching. There's such a thirst and hunger for knowledge and enthusiasm. It's a great atmosphere, and it reminds me of a kind of my day-to-day experiences at Moorfields. So I hope to be able to work with JC and her colleagues and all of you more closely in the future. Keep well, everybody. Thank you.